Hello everyone, I'm Dr. Salman, consultant plastic surgeon at Dr. Salman Aesthetics, Islamabad and Peshawar. Today we'll talk about an ultimate guide to rhinoplasty. Rhinoplasty या nose job, बहुत ही common surgery है, but people have very little information about that. Today we'll talk about how rhinoplasty is done, what can you see, what happens afterwards, and how to expect the results. First of all, understanding rhinoplasty. Rhinoplasty है क्या? It is a surgery of the nose जिसमें हम फंक्शन को भी इम्प्रूव कर सकते हैं और कॉस्मेटिक्स को भी इम्प्रूव कर सकते हैं. फंक्शन इज द ब्रीदिंग, सांस एक तरफ से दूसरी तरफ से बैलेंस जाए. कॉस्मेटिक्स आर कि नोज स्ट्रेट हो, उसकी शेप आपके फेशियल स्ट्रक्चर के मुताबिक ठीक हो, उसमें हम्प ना हो, उसकी टिप ठीक हो, ना बहुत छोटी हो ना बहुत बड़ी हो. दिस इज what a rhinoplasty is. Now, the most important thing in rhinoplasty is consultation. While in my experience, लोगों के ख्याल में rhinoplasty में सबसे ज़रूरी चीज़ यह है कि cost. This is the commonest message we get on all our social media platforms, on all my numbers. Cost? Question mark. No, this is wrong. First, you must have a consultation, जिसमें आपका डॉक्टर assess करे कि आपकी deformity कितनी है. कभी डिफॉर्मिटी इतनी होती है कि उसे हम एड्रेस कर सकते हैं, कभी डिफॉर्मिटी ऐसी होती है कि जिसे हम 50% करेक्ट कर सकते हैं. यू नीड टू सिट डाउन विद योर सर्जन, डिस्कस ईच एंड एवरी एस्पेक्ट ऑफ योर नोज, योर ओन पर्टिकुलर केस. ये ना करें कि आप औरों की पिक्चर्स लेके आएँ कि मुझे ऐसी नोज चाहिए. मैं कभी भी शाहरुख खान वाली नोज नहीं बना सकता. आई हैव टू इम्प्रूव द नोज वट एवर फीचर्स यू हैव, so I can give you a refined version, a better version of yourself rather than copying out somebody else. This is why consultation is important. उसमें मैं assess करता हूँ patient को from 5 angles, the front, the profiles, from below and from the top. That's where you get all the deformities. फिर कुछ deformities ऐसी हैं कि जो bone के level पे हैं, कुछ उससे नीचे cartilage के level पे हैं, कुछ उससे नीचे tip के level पे हैं. Then I discuss each and every deformity in detail. मैं पेशेंट को बता देता हूँ कि ये चीज़ें पॉसिबल हैं, ये चीज़ें पॉसिबल नहीं है. After that, I ask the patient if she or he is satisfied with that, then we proceed with surgery. अगर वो satisfied नहीं है, तो वो जो पहला वाला question है, cost and question mark, that is totally useless. Once you and your surgeon, you know that this is the deformity, this is the level of correction, वो चीज़ जब आपके माइंड में आएगी, you will be happy with the result. अगर वो नहीं आएगी, no matter how good the nose in itself is, if it doesn't match your face, you will not be happy. Type of rhinoplasty. Now there are two major types of rhinoplasty: open technique and the closed one. ओपन टेक्निक ये है कि यहाँ पे छोटा सा एक इंसिजन होता है, बाकी इंसिजन नोज के अंदर होता है, उससे हम पूरी नोज को खोल लेते हैं, देन वी करेक्ट द डिफॉर्मिटी. दिस इज द कॉमनेस्ट टाइप ऑफ rhinoplasty. Cosmetic surgeons worldwide prefer this open rhinoplasty technique. The other one is a closed rhinoplasty. Closed rhinoplasty में जब deformity बहुत कम हो, जिसमें हमें थोड़ा सा exposure चाहिए, that is where you can employ closed rhinoplasty. But even with the best of surgeons who do rhinoplasty very frequently, closed rhinoplasty is less than 5% of the cases. 95% of them is open rhinoplasty. There is a third type called liquid rhinoplasty or rhinoplasty with fillers, जिसमें हम fillers को use करते हैं और उसमें हम उस deformity को कम या ख़त्म करने की कोशिश करते हैं. Now the surgical procedure of rhinoplasty, हम क्या क्या करते हैं? Every patient must know it's a long procedure. It's about 2 to 3 hours under general anesthesia. उसमें हम पहले nose को local anesthesia देते हैं. We do the marking, we identify the deformed areas, क्या क्या हमने करना है, full plan is there. फिर उसके बाद we give the incision, open up, separate every structure, correct each and every structure. हर एक piece को हम अलग अलग बना के जो उसमें deformity है उसे ठीक करके फिर उसे हम दोबारा बंद कर देते हैं. उसमें we put up a splint on the outside. We also put 2 splints inside. Normally I like to remove these splints at 1 week. So the next morning after surgery, जब आप उठते हैं, we remove the dressing from the inside so you can breathe. जो splint है, that stays for 1 week. Internal splints also stay for 1 to 2 weeks, wearing depending on the case to case. Or it's not a very painful procedure, but After surgery, you will definitely have a lot of bruising, swelling, जिसकी वजह से you feel very different. But everything goes away and you have about 50% of your result is obvious when you just remove the splint. Then when the swelling settles, it takes about 1 to 6 months depending on the type of skin, or things keep on improving until 6 months. Results and long-term care. Results, they are obvious right after you remove the splint, but the swelling, it takes about 3 to 6 months to resolve. That's where you get the final result. Long-term care, initial care is important. First 3 months, try to avoid contact sports, football, running, be careful in the washroom. इसके अलावा कुछ ज़्यादा केयर करने की ज़रूरत नहीं. In rhinoplasty, there are certain risks and complications. Even the best surgeons in the world, they have about 10% revision rate. The revision rate ये है कि मैंने एक surgery की and you're not satisfied with the results, or if something goes wrong, a lot of things can go wrong. Rhinoplasty में we talk about the fourth dimension, which is wound healing. Wound healing can be different, can be awkward. कभी-कभी deviation आ जाती है, कभी-कभी थोड़ा सा hump जैसी feeling आती है, कभी-कभी it could be a very broad tip. So at least 10% of rhinoplasties worldwide go under revision. Complications are all treatable. अगर आपका surgeon ठीक है, आपकी choice ठीक है, he's a plastic surgeon, he has good experience with rhinoplasties, then the complications are minimal. But 90% of the cases, they're very happy and it's a life-changing surgery. This is the most important part. Do not choose your surgeon because of the low cost. Choose a surgeon based on his qualifications. He must be a plastic surgeon, he must have experience with rhinoplasty, and he must have the ability to discuss your deformity and tell you honestly कि ये चीज़ हो सकती है, ये वाली नोज बन सकती है, और ये जो तस्वीर आप लेके आएंगे, ये वाली नोज नहीं बन सकती. If there is a surgeon who says that this thing cannot be done, that is probably a good surgeon. अगर कोई आके ये कहे कि ये जी आप जो कह रहे हैं वो बिल्कुल हो जाएगा, that means the person is more into doing the procedure rather than giving you the best possible results. In conclusion, I would say rhinoplasty is a life-changing surgery. अगर किसी की नाक टेढ़ी है, for 18 years he has lived with that, and you correct it, it's an amazing feeling because this has long-term results. It stays there for the rest of your life. So it's a surgery which can change your life provided you choose the right surgeon. Thank you.